Hey guys, it's Manu, Kalia, physical therapist and herbalist. So this video I'm going to show you a massage technique, specifically a cross-friction massage technique to help you with ankle sprains. So specifically we're going to talk about inversion sprains where your foot rolls in. And this is the most common type of ankle sprain where you end up getting the foot rolls in and ends up injuring the ligaments on the outside and possibly resulting in the joint alignment being off. As well as if the sprain is strong enough, if you have a severe sprain, you can not only have tears to the ligaments, you can also get a trauma or injury to the inside of the ankle too. So this technique is specifically for working on your anterior talofibular ligament, which is a more commonly injured one in this kind of a sprain. So what we're going to talk about is that ligament basically sits right along this area, okay, like this. So this is your fibula and your talus is here. So if I turn my foot inwards, that ligament will be getting stretched, okay? So one of his job is basically to prevent the over movement, I guess you can call it, or excessive movement of that motion, right? So it's restricting that, in addition to a lot of the muscles that are also preventing excessive movement. So if that ligament is injured, if it has some trauma, it can turn into thickening or adhesions that can form, or microfibers and tears. And after a while, it can become a chronic issue where you end up getting swelling, pain, which tends to persist for months. And sometimes I've seen patients even after years coming back with that kind of problem. So besides correcting the joint mechanics, one other technique you can do is you can work at doing cross-friction massage technique to break down some of the thickening and adhesions that have formed around that ligament and some of the soft tissue. So as I said, this is your fibula, okay, outside of your ankle, and that ligament is sitting approximately, it's the anterior talofibular ligament. So in the front of the fibula, so it's in this region right here, and it's going to be often tender when you palpate it. So if the ligament is going this direction, we want to go across the fibers, right? So what you're going to do is you're going to work at, once you find that tender spot, you're going to work at doing, I can even put my foot in a little bit of inversion to expose it further, and then I'm going to work at doing massage. So I place a little bit of pressure on that, and then I go across the fibers back and forth, doing cross-friction massage. Just rubbing on the skin is not going to do it, okay? So, and it can be tender, so spend about 5-10 minutes initially. Don't put too much force on it early on, and see how you respond to it. So do it once, and then see how you do that day or the next day. If you find out that you're too sore, obviously back off for a couple of days and then redo it. Each successive time you work on that, it should get better and better, or less and less painful, or there'll be less and less adhesions, thus you're going to have less and less sensitivity of that tissue. And over time, over a few weeks of regular work, in addition to, of course, correcting the joint mechanics and all the other things, it'll help getting that ankle a lot better. All right? So if you have any questions, leave a comment, subscribe to the channel, and check out the site, guys. I have lots of info on it. Thank you.